Hi friends, welcome back to the Holistic Health Podcast. Ames, good morning. How are you?
I'm good.
Is it even morning? It's not.
It's not. But we
We're
can
having a
pretend
bit
it
of a
is.
week. Yeah. We only just made it out of the house after trying to escape the two golden retrievers at the
Yeah.
door. It's just, I don't know why it like is just as exciting each time someone enters, but it really, I do think outside of the puppy phase and the difficulty that I had with that, it's so joyful having a dog.
And I think golden retriever energy is pretty special.
It's the best energy.
Yeah.
Bo and I always joke that Chino brings up our team average because he's so good looking.
He's
We're
stupidly
like,
handsome.
thank God for you, son.
He's
Our
so
little
cute.
king. I know. Anyway, unrelated to golden retrievers and the benefits of dogs, we're actually talking about PCOS today, particularly as it relates to fertility, because I know that for both of us, we work a lot in the fertility space and also in the PCOS space. And I think sometimes there's a lot of confusion or half bits of information as far as how does having PCOS actually impact fertility. So while we have done other episodes on PCOS just generally speaking, which you can go back and listen to, and we'll pop the actual episode numbers in the show notes, what we wanted to do today was more highlight how or like what are the main mechanisms or areas that actually lead to there being subfertility in PCOS, not infertility. You can absolutely still fall pregnant and have a healthy baby even if you've been diagnosed with PCOS. It's more that I actually think personally it's a reason, and you'll probably understand more soon, as to why doing good solid preconception care is actually so important always, but God, it's extra important in PCOS in my opinion. So the first area I would say, or the first thing that I always explain to people who have PCOS that are concerned about fertility, is that the high androgens that come with PCOS is definitely something that impacts fertility to a degree. And a lot of people are familiar with that. I feel like most people who have been diagnosed with PCOS are like, oh yeah, I've been told I've got high testosterone or high androgens, and that's part of it. And a lot of the time we link that to skin issues that people might be familiar with that we've spoken about before. But what is probably not understood in more detail is how it relates to fertility. So one thing to just set the scene is that whenever, like in normal circumstances, your eggs are going through folliculogenesis or like egg maturation essentially. And usually there's one dominant follicle that is, specifically and well regulated, timing wise and attention wise, developed to become this quote unquote dominant follicle. But in PCOS, that process of maturing eggs is kind of interfered with because there's changes in LH and FSH, which are hormones we've spoken about before that are brain derived to in a sense, and they set the tone of what helps to dictate your hormones and dictate things like estrogen, progesterone, etc., testosterone. And so it's partly that interference with the with FSH and LH that happens, but also there's an inhibition of one of the enzymes that converts androgens into estrogen that then has flow-on effects into, again, compromising the maturation of those follicles, and that impacts fertility because your follicles are your eggs essentially. I'm completely molding terms here for simplicity's sake, but that's really a really important factor to know. And also that process is driven by high androgens. And what we do know is that in PCOS, those androgens are higher. So we know that interference is happening. We know that folliculogenesis, or the maturation of eggs, quote unquote, is compromised or challenged to a degree. And what we know from that as well is that when that's happening, we also get more localized inflammation in the ovary. And anytime there's inflammation or oxidative stress, it's always going to impact the quality of the egg. And the quality of the egg very much determines in a large part the likelihood of a successful pregnancy, both in terms of falling pregnant but also in holding that pregnancy. And I think the other thing that is important to know is high androgens do definitely interfere with ovulation. And as we've spoken about many times on this podcast, the only way you can fall pregnant is actually if you ovulate. So if we're having interferences with ovulation through those elevated androgens, then we're kind of in a bit of trouble. So the other thing is that and you'll hear this in how we're speaking about it throughout the episode, but whenever we think about that, we don't just go, as naturopaths and holistic practitioners, we don't just go, oh, they've got high androgens, so full stop. We go, okay, so why are their androgens high? And that's, again, going to lead us into the next kind of area that we'll discuss, because sometimes you can have a high androgens from a genetic perspective, and then also there's many reasons that you can have high androgens from what we call an epigenetic perspective. So basically influence of things that are outside just your blueprint. So environmental factors. So that might be our lifestyle, our nutrition, our supplementation or lack thereof, all of the stuff that we talk about all of the time. So it's really important that we take all of that into consideration, and also know that even if you do have a strong genetic component to your PCOS, that many of my clients do, it doesn't mean you can't influence things. It just means that you really need to be on top of influencing those things so that we come out as a net positive. So speaking of like high androgens and environmental influences or other factors that can contribute to it, what's another common issue that drives, I guess, fertility challenges in PCOS?
I was just reflecting on everything you were just saying, actually. And as someone who used to have PCOS, I'm looking at like my family history. My mum had familial hyperandrogenism in the family. My mum was actually medicated for that her whole life until menopause. And I can't say what was driving hers at the time, because she was never properly assessed or nothing was actually properly addressed. But certainly for me, a big factor of it was insulin driven. And that's probably the most common one that we would see, I think, is with insulin resistance. And there are, again, it's not just, oh, you've got high androgens, let's treat it. It's not just, why have you got high androgens? In this case, is it insulin resistance? Why have you got insulin resistance? There's, what's the cause of the cause of the cause? And so hence why there's no one size fits all when it comes to sorting this out. But just before I dive into insulin resistance, though, I will say, just from a really practical point of view with PCOS, is the fact that it interferes with the timing of ovulation can really mess up people's fertility plans.
Yeah.
So, I'm worked very hard on my hormones and my insulin sensitivity, and I also had a degree of adrenal PCOS in there too. And, and most PCOS clients, they have longer cycles. And what that means is you have numerous often attempts at ovulation, and you can't sort of reliably predict your fertile window, which really, from like just a sex fatigue point of view, is exhausting, because you keep having fertile signs where you're attempting to ovulate, but then you fail to, and then so your body keeps trying it again. Also, for that matter, the very conditions under which that failure to ovulate is being caused, and the subsequent imbalance between estrogen and progesterone that results from that also is in the mix. So timing, the quality of the egg under that much of influence of FSH, just chronic stimulation. There's just so many layers to it. And I will just say, for any PCOS girlies who are listening thinking, oh my God, I'm doomed.
They've already turned off
the episode. They're like, I'm out. I'm
young.
calling the IVF clinic immediately. You are perfectly fertile, just so you know. PCOS does not mean infertile at all. It just means that the waters are muddied, and there are things that need to be addressed in order for conception to come easily and to optimize egg quality and, you know, the likelihood of implantation and things like that. So it's a many-layered web, if you like, but focusing specifically on insulin resistance. So the ovaries actually have a very dense concentration of insulin receptors. So they are very sensitive. Like, there's lots of reasons for insulin resistance, but when we have insulin resistance, which is a condition where the cells are resisting insulin's messaging to move glucose intracellularly, we then have a bit of a domino effect with other things, and that can be both locally in the ovary and also outside of that. So there's a particularly high concentration of insulin receptors in the thecal cells, stromal tissues, and the granulosa cells, which of course is where the follicle development is occurring. And because of this, they become very stimulated as our body tries to produce more insulin to move the sugar out of the bloodstream. There is this I guess, what's the word I'm looking for? There's a catabolic response, if you like, or a hypertrophy style response from these particular cells in the ovary, which totally change the physiological mechanisms in there under which the normal conditions where an ovary would develop multiple follicles for ovulation in a timely manner. And so what happens then as a result of that is this triggers, amongst other things, increased secretion of androgens, which we classically will call male hormones. But of course, all women produce androgens to some degree, and they're a healthy, normal part of our hormonal symphony orchestra, just like men produce estrogen. That's also normal, but just in the right amount at the right time. So this increase in androgen secretion, of course, then has that knock-on effect to influencing ovulation. Typically for PCOS sufferers, this is myself included, the things that we often focus on is increase in facial hair, or, you know, the acne that comes with it, the recalcitrant acne, which I experience both of those things. And then just to kind of add insult to injury, there's also an impact on the secretion of SHBG, or sex hormone binding globulin. And the way I describe that to clients is like, we're producing hormones all the time in response to all kinds of things, not just brain signals that are directly influencing, but, you know, our nervous system, our gut, everything influences that. And in this case, we'll see SHBG, its job is like the cleanup crew. If there's too many androgens in the system or too much estrogen, we're supposed to make more to kind of clean it up and mop it up and capture it for elimination. But when we see insulin resistance occurring, we can see SHBG take a dive, and then there's less of the cleanup crew to clean up excess hormones. And so it becomes this amplification, if you like, of the hormonal dysregulation, which is, of course, secondary to, in this case, insulin resistance.
Can I add there, because relevant to exactly that point, linking in the genetics as well, is that like a lot of people with PCOS also have genetic SNPs or variations in that SHB, like in the gene that is speaking about SHB production potential.
Yes.
And so often you get this double whammy of a genetic influence of already you might have a tendency to make a slightly lower amount of sex hormone binding globulin, and then you've got the insulin resistance on top of it, and it really tanks. And I think it's a perfect example of the interplay of where you can have genetic influence and then environmental influence, and then why it's so important where you can't change your genes, but you can change the environment to make sure you manage that insulin side of things.
Yes, and I think that's really important. So I went through a stage of doing a lot of genetic SNP testing for patients, partly because they just wanted to know, or partly we were exploring what might be behind it. And, you know, even more broadly, you've got SNPs in the gene that produces luteinizing hormone, which is responsible for triggering ovulation. You've got SNPs in cytochrome P450 enzymes, for example, 19A1. If you've got down-regulated aromatase activity, you have, I guess, a reduction in the conversion of testosterone to estrogen, which allows testosterone to be elevated independent of any of those other things. But you make a really good point. Like, genetics, whilst they are very interesting and you can't change your genes, there's a lot you can do to change your genetic expression, which again comes down to environment, lifestyle, supplements, things like that. So there are an awful lot of factors, and I think when it comes to PCOS, this is why I think you and I both get extremely frustrated when we see like one size fits all, like hormone balancing formulas.
Oh, don't get me started. I had a couple of new clients this month that were on some. They're like, "What do you think of this?" And I'm like,
Hate.
I need to tell you something.
Yeah, I'm biting my fist right now because yes.
It's hard because I get the desire naturally to want to DIY, and in part I love that people care about their health, they're willing to invest in it, and if you're lucky you might just be the perfect fit for that hormonal balancing formula, but I'm yet to see the day that that's the common thing. I'm not saying that they aren't helpful for some people, because there are certain hormonal presentations where you've struck luck, but I don't know. I honestly think if you ask most naturopaths that know what they're talking about when it comes to hormones, and you look at some of those formulas, I'm like, you've got a herb in there that's like increasing androgens or estrogen, and then you've got ones that are clearing it. Like, make up your mind.
Yeah. What are you trying to do here?
Yeah,
Is it one
I
or
feel
the other?
nauseous.
Yeah, absolutely. And probably the person taking it might as well.
Yeah.
Oh my gosh.
Anyway.
Yeah, it is very nuanced, and it should be very specific and personal to the patient. And, in this case, looking at the variables that play into insulin resistance is a big one. And I definitely had a degree of adrenal PCOS as well. And, anytime we see that, we have problematic feedback to the brain with gonadotrophin releasing hormone, and therefore the stimulus from upstream with FSH for follicle development. But there is also another big player that I think we need to talk about.
Inflammation. Got it, didn't I? Yeah. And I know, God, what a hot term. It's like protein and creatine, inflammation. But legit inflammation, specifically this chronic low-grade inflammation that is shown to be higher in people who have PCOS. And, again, like we were saying before, the question is not, do you have inflammation? Answer, yes. Okay, let's decrease the inflammation. The question is, do I have inflammation? Yes. Okay, where's that inflammation? Where are those inflammatory drivers coming from? And in the case of PCOS, probably often, in my experience, multifactorial. So insulin resistance, yes, being one, estrogen excess or deficiency being another. And by the way, both can occur in PCOS. It is not a condition of estrogen excess exclusively, though that can coexist. And so it's just, again, important to test your hormones to find out, rather than just assume and then go clearing your estrogen with broccoli sprouts and lots of other things, and then end up in a worse position. And then other things would just be nutrient deficiencies, high homocysteine, which reflects your methylation pathway. So a lot of people have heard of the quote on the MTHFR gene, or the motherfucker gene as it's known as well. So homocysteine is one marker in your blood that can reflect to a degree how well that process is working. So we want to make sure we're testing that and optimizing that if it isn't in a good range. And then other things would be like endocrine disrupting chemicals, which we speak all of the time about, stress, anxiety, high androgens that we spoke about earlier, and also gut dysbiosis. So it's really important, if you have gut issues, that they are addressed as part of addressing your PCOS and part of influencing your fertility and part of preconception care, because it's not separate. As hopefully, if you're listening to this podcast or have been for a while, you realize by now that everything touches everything. And that can feel really overwhelming, or it can feel really empowering and efficient is how I like to see it, because it means when we start to heal one thing, other things fall into line. And then the other thing I would say is that when it comes to inflammation, as it directly relates to fertility, essentially what it comes down to is it impacts egg quality, it impacts ovulation, and it impacts implantation and also placentation, which is like the setup of the placenta, which feeds the baby and allows it to continue growing. So I'd say it really has a role, like addressing all of this has a role to play in helping with reducing miscarriage rates as well, because sometimes you will fall pregnant, but because there's been, not an amazing setup of the placenta, it can lead to miscarriage later. And again, this is not to scare you. This is more to empower you to say that if you take preconception care seriously and you get in the hands of a practitioner that really knows what they're talking about and is looking at your case not as a cookie cutter PCOS case, but you as an individual and the factors that are creating your situation and how do we best influence them, you're in a really good position. And genetics aren't the determinant of things. It's everything we do around it that really ends up creating the outcome. It is what I see all of the time.
Yes, it's such a good point. And the last thing I wanted to add with the inflammation story is that inflammation damages mitochondria, the parts of our cells that make energy. Ovulation is a very energy hungry event, which also then can mean delayed ovulation and delayed egg quality. So yeah, there are just so many things you can do. And I would like to just say I'm living proof of that. Like I have a clockwork 28 and a half
I
day
can't see a
cycle.
single hair on your mo right
Well,
now.
I did pluck a couple of chin hairs this morning, to be perfectly honest.
Don't you reckon everyone has like one or two
Of
chin
course,
hairs?
yes, and nipple hairs. Like,
Oh,
yeah.
God, I love plucking all those hairs, especially at the traffic lights when the light just hits the right spot on the mo.
Why is it the front seat of your car is like the best place to see all of those imperfections? Like everyone needs a set of car tweezers for those moments.
I have one right in my, like right next to the driver's seat. It's my favourite thing, although I'm yet to figure out how to look subtle doing it.
Can't
Do
help you
people
there.
think I'm just scratching my chin? Sometimes I hold the tweezers really close to the tweezy part to go,
So it doesn't
maybe
look-
I'm just stroking my beard or
That it's my
itching the
thinking
top
here.
lip, you know?
Well, look, I remember in the thick of it, I remember plucking out like 21 from one side. I used to count them. But it was just ridiculous.
That's really special that you used to count
I know. I was obviously a bored teenager,
Yeah.
but I will say is I know what it's like to, to deal with that. I had horrific acne. It's why I studied to be a beauty therapist and did all of the skin things, wrote a book about that because it was just so devastating for me. And I can hand on heart now, I mean, sure, I might get the odd pimple, but I mean, you've known me for quite some time. My skin's generally pretty good. You haven't spotted any 5 o'clock shadow yet.
I haven't seen any like rogue moustaches, beards happening, and I've known you for quite some time now.
Yes. So there is hope. So if you are dealing with PCOS, please know it is something that responds incredibly well to diet, herbal medicine, nutritional medicine, lifestyle intervention. It's just a little annoying as an ex-PCOS girly that's like my Achilles heel. So I have to be really mindful of that with blood sugar, insulin, and stress and sleep. That being said, this is not a mystery as to how we resolve this. In fact, if you want to get started, Nat actually has an incredible resource that you can buy off her website called the PCOS Wellness Blueprint. Really affordable, covers the foundations really nicely. So if you just don't even know where to start or what's available, I highly recommend that. And of course, Nat and I love all things lady business and hormones. So if you are looking for one-on-one help, you want a deeper dive, you want a personalized approach, maybe you want to have a look at your genetic SNPs as well so you know what's going on under the hood, so to speak, then you are more than welcome to reach out to either one of us to get some more specific tailored support. But outside of that, especially if you're trying to conceive, 10 out of 10 recommend, by the way. Otherwise, you're taking the slow way. It might take you 6-12 months. They might try and push you into IVF, which is probably unnecessary, especially if you haven't done the work already. And so, yeah, please reach out if you need any help. And I hope if you've been listening to this has inspired you to actually dig a little bit deeper into what's going on for your PCOS.
Amazing. We'll see you next week, friends.
See ya.